Now, on to probably...
Cory has been out and about this week. Let's just say
I've been busy. But one of my favorite segments of all time, probably.
Mine too, for the record. Getting to watch that.
I love this place. I love the people that work at this place. Chelsea and Angie, obviously I'm related to Chelsea, but, well, and I guess technically related to Angie too.
Yeah.
So
Aren't we all related in this town?
Aren't we
Somehow.
all? We're all
Less
Woodford.
than 6 degrees.
Oh,
Separation.
yeah, it is Kentucky. Oh man. I go to court, man, and I go to court, and I legitimately go to court because I actually do have back pain, and I'm gonna be completely honest with you. I feel great just after that short segment there. I mean, just a prerequisite real quick before we get into it. I'm deathly afraid of, deathly, but I do not like needles.
Yeah.
Hate needles.
No, not a fan.
But I'm telling you right now, don't let that stop you from doing this segment.
I think they said there was 6 of those little needles that would be in one vaccination needle. So it is even tinier than the tiniest needle that you would think of when you get a shot at the doctor.
Yes, and not to give too much away about the segment, but no, zero pain. It's like one big massage. The whole thing, the whole experience. I enjoyed it. I made an appointment right there, and I'm going back there Wednesday. So
it's good self-care. I was thoroughly impressed with what they offer there. I had no idea they did all those things.
Yeah, totally. And how easy it is to get it, to do it.
Yeah.
Oh, anyways.
But can you answer the question, did you really cry beforehand? No,
I didn't cry. I was nervous though. I really was. I had not done any of that type of therapy, and I'd seen it in movies. Yeah. But no. Yeah, it was virtually painless. It felt great afterwards. It still feels good today.
That's awesome.
So, and I'm not just saying. I swear to you, I'm not just saying that. I'm honestly being truthful with you guys.
Personal testimony there, and you don't have to have a doctor's order to go. Anybody, they call it direct pay or direct access, and they're doing so much, which they'll tell you about in a segment. But to be safe and doing home visits and tele-rehab and all that great stuff. So definitely check this out.
Absolutely.
What's up, Woodford? We're here today at KORT Physical Therapy in Versailles. Today I'm joined with Angie. Angie, can you tell us a little bit about what KORT does?
Yes, KORT Versailles is outpatient physical therapy. We have physical therapists who are doctors of physical therapy, and they specialize in neck pain, back pain, hip pain, knees. Any musculoskeletal pain you have, they are the experts.
And what I learned today, Angie, is that you don't have to have a doctor's order to come here, and you can actually be a first stop to try this before going into somewhere else, right?
Absolutely. And especially with COVID and, trying to limit your exposures, not to completely bypass your primary care doctor, but at the same time, you do not need a physician referral to see us. So, and again, being able to take advantage of your end of the year insurance benefits so that you can leave those aches and pains in 2020. All you have to do is call directly to get scheduled, and they'll make sure that your insurance covers you.
I love that. Leave our aches and pains in 2020, just where they belong. If somebody is interested but is not sure if their insurance covers, how do they find that out?
Yeah, that's a great question. You can call our clinic directly. You can visit us at KORT.com. If you're not in the Versailles area or you work in Lexington, Frankfort, Lawrenceburg, we have over 65 clinics throughout the state. But if you just give us a call, our patient service specialist will check it with your insurance and find out exactly what your copay is, or if you have co-insurance, exactly what that out-of-pocket expense will be.
Awesome. And speaking of COVID and safety, that is of everyone's utmost priority. Can you tell them a little bit about what precautions you guys are taking here?
Yes, without a doubt. We really pride ourselves on the safety precautions that we're taking. When a patient, when it's time for their appointment, they call from the parking lot, and our patient service specialist will ask them a few screening questions. And if they pass that screening process, they will enter into the clinic, and we take their temperature, and then they wash their hands and get started. We're doing lots of extra cleaning in between every single patient, of course, gloves, mask, all of those. But we also have 2 other options that we are seeing patients and that insurance will cover. So if if anyone doesn't feel comfortable coming into the clinic, you can still take advantage of tele-rehab or us coming into your home.
I
So
love
again,
that.
no excuses, right? No excuses
Yes, very flexible.
of leaving those aches and pains in 2020.
And if somebody comes in and they say, I don't know what services I need specifically, who is KORT for? I see an athlete's wall, but it's not just for athletes. It could be for anybody, right?
Absolutely. I mean, again, anyone who's having musculoskeletal pain. And so that's all ages. I mean, we even see babies for torticollis. But again, if you've just, if you've been playing soccer and you're a weekend warrior and you've like tweaked your knee, we're the person for you. A lot of people are working from home and not used to working from home. So they're spending more time, on their computer. And so the neck pain, back pain is really becoming an issue. So again, really all ages. We see people after hip surgery, knee surgery. We go into their home for that until they're ready to come into the clinic. So
There's truly something for everybody here.
Yes.
They are located in the Kroger Plaza. If you guys haven't checked them out, give them a call. Check out their website. Check out their awesome social media. And are we going to put Cory to work now, you think?
Yes.
All right.
Without a doubt. This is going to be fun.
Let's do it.
He's going to be leaving his aches and pains in 2020.
Hi everyone, my name is Kenneth Couture. I'm a physical therapist here at KORT Versailles Physical Therapy. I'm going to go ahead and demonstrate a little trigger point dry needling. This patient here has been experiencing some chronic neck pain just due to multiple injuries over the past couple years. So I'm going to go ahead and demonstrate what we'll be doing here.
It's my wife hitting me over the head with a frying pan. That's the injury that you're referring to. Thank you for keeping that a secret, though. So the sensation is strange. It's not bad at all. It's like a warm like constant massage. How many are in me?
Right now there's just one on each side.
One on each side. Definitely interesting feeling.
All right.
A little to the top, Kenny. Thank you.
Okay, so this is called cupping, and once again, if you're dealing with chronic low back pain or some type of issue where some of these muscles just tend to be super tight over the years of just inflammation, pain, that sort of thing, there's something called a fascia. And if you think of your mattress would be the actual muscle belly, whereas a bed sheet would be the fascia. So it's a covering that kind of overlies the muscle, or kind of lays across the muscle. And sometimes what can happen is that fascia will stick to the muscle itself. And so what cupping does is it tends to kind of lift that up and allow some of that inflammation, congestion, some of that tightness to subside, and allow circulation to get in that area as well and help give the patient some relief. So I'm going to go ahead and demonstrate that for you here.
I thought you said fashion. And I'm like, that's all Emily. That's all Emily. I have none of that. There you go. Oh, goodness gracious. Ah!
All right.
I mean, it doesn't hurt at all. It's just a funny, I mean, I know what you're doing. I wish I could see it. Oh boy.
Well, you can see the left side's a little bit tighter than the right, requiring just a little bit more there. How are we doing?
We're doing good. I can feel the tightness, but once again, I'm telling you, I don't know if you probably don't believe me, but I'm telling you, there's no pain. I don't feel there's no pain to this. I think I need to do this on my stomach. I need to suck out a little fascia from my stomach region.
Doesn't work on the stomach region.
Got it. Noted.